How do WPATH standards of care impact gender-affirming surgeries? Imagine trying to change something about yourself that feels deeply right but facing many hurdles along the way. That's where the World Professional Association for Transgender Health, or WPATH, steps in. Their standards of care are like a map for healthcare providers, guiding safe and respectful treatment for trans, gender, non-binary, and gender-diverse people. These guidelines influence how gender-affirming surgeries are offered and accessed. They help ensure that surgeries are performed ethically and with the person's well-being in mind. The standards start with making sure someone has a clear diagnosis of persistent gender dysphoria. This means they experience ongoing distress because their gender identity doesn't match the sex they were assigned at birth. Usually, a mental health professional with experience in gender issues must confirm this diagnosis. Once diagnosed, the person needs to show they understand what the surgery involves, including risks and benefits. This is called giving informed consent, and it's a key part of the process. Before surgery, individuals often undergo a psychosocial assessment to confirm they are mentally stable and have support systems in place. For genital surgeries, the WPATH guidelines recommend that the person is at least 18 years old, has lived in their affirmed gender for at least 12 months, and has undergone hormone therapy for at least a year unless there's a medical reason not to. These steps help ensure the person is making a well-informed, sustainable choice. Getting approval for surgery also involves documentation. Usually, a letter from a primary care doctor and at least one mental health professional is needed. For genital surgeries, two separate mental health assessments are often required, with one from a doctor holding a doctoral degree. These letters should be recent, written within 18 months of the surgery date. The WPATH standards are flexible, not strict rules. They allow for individual circumstances, especially if delaying surgery could cause harm. For example, in adolescence, hormone blockers are recommended after puberty begins to give more time for decision-making. For intersex children, the guidelines say that irreversible genital surgeries should be delayed until the person can give informed consent unless medically necessary. These standards also serve as a benchmark for community advocates and healthcare providers. They help protect against unnecessary barriers and discrimination. By setting clear, evidence-based guidelines, WPATH helps people access the care they need and deserve. They influence what procedures insurance covers, what paperwork is needed, and how different healthcare providers work together. Some community members critique certain parts of the standards, like the requirement for multiple mental health assessments or waiting periods. They argue these can sometimes slow down access to care. Still, the overall goal is to balance safety with respecting individual autonomy. The standards continue to evolve through ongoing discussions within the community. In the end, WPATH standards of care shape the entire experience of gender-affirming surgeries. They guide clinical practice, influence policies, and support advocacy efforts. Knowing about these standards helps individuals understand their rights and navigate the healthcare system confidently. They are a vital part of making sure transgender and gender-diverse people get respectful, competent, and affirming care.